When we are covering a game on the field, the things that we look for on the athletes is based on, one, the hit itself. So if we're lucky enough for either the coach, the athletic trainer, or the physician to see the hit, then sometimes that can make us worry that the athlete sustained a concussion. If they complain of symptoms, then it makes it a little bit easier, because then you can kind of look at all the symptoms they're having and correlate it with the hit that they had. But then also just watching them, how they return to play. So are they slow to get up after they get a hit? Are they able to maintain their balance? Do they remember their plays? Are their friends telling us that they're complaining about symptoms? So those are the things that we look for on the field.
So they're holding their head. When an athlete's body appears to go limp or crumbles immediately after a hit and they don't move. When an athlete gets up and staggers around clumsily. When an athlete is very slow to respond to my questions. If I observe any of these signs, the athlete is removed immediately, and he or she would be assessed on the sidelines and managed appropriately. Sideline assessment would include symptom monitoring, balance assessment, questions to assess orientation and concentration. We'd also do some special tests, such as vestibular ocular motor screening, or VOMS, to assess visual function and reflexes.
Coaches need to learn to suspect when concussions may be present just by observing the injury itself. If someone takes a particularly hard hit, they're really slow to get up. They need to be aware of their athlete's normal behavior. So if an athlete starts behaving differently in the course of a game, maybe after observed collision injury, or maybe it was a collision that they didn't see or that looked fairly routine or normal, but the athlete comes back and starts reporting that they don't feel quite right, they're having trouble focusing, they may have a headache, they may feel dizzy. It may be a teammate that says, I'm not sure if this particular teammate is doing well. Coaches just need to be aware that these things might happen and have a low threshold for saying, you know what, it's better to pull you out and get this checked out, keep you safe, and return you back to the next game than potentially take the risk of worse injury or missing the rest of the season because of a concussion.